In every community, some stories gently challenge assumptions, stories that remind us that ability is not defined by a diagnosis, and that every individual deserves the chance to live fully, visibly, and with dignity. One of these stories begins with understanding Down syndrome itself. Down syndrome is a genetic condition caused by the presence of an extra copy of chromosome 21. While it may affect learning, physical development, and health in varying ways, it does not determine an individual's worth, personality, or potential. Individuals with Down syndrome grow, learn, form relationships, pursue education, hold jobs, and contribute meaningfully to their communities, especially when given access to support and opportunities. In the late 1970s, families raising children with Down syndrome often faced isolation, limited information, and low expectations imposed by society. After the birth of her daughter Carson in 1978, Betsy Goodwin, alongside Arden Moulton, recognized the urgent need for change. Families required knowledge. Individuals required resilience and advocacy. The nation needed a new narrative. In 1979, that vision became the National Down Syndrome Society, NDSS. Not just an organization, but a promise to advocate, to educate, and to stand firmly for human rights. From the beginning, the National Down Syndrome Society, NDSS, defined its mission clearly: to be the leading human rights organization for all individuals with Down syndrome. The organization focused not on limitations, but on inclusion, addressing education, healthcare, employment, aging, and independent living across the lifespan. Down syndrome is not a single story. Each individual has unique strengths, challenges, and aspirations. The National Down Syndrome Society, NDSS, exists to ensure systems evolve to meet individuals where they are, through reliable information, family support, and community connection. Advocacy is central to this mission. The National Down Syndrome Society, NDSS, works with federal agencies and local leaders to advance policies that protect rights and expand opportunity, from inclusive education and fair wages to equitable healthcare, and address the increased risk of Alzheimer's disease, AD, associated with Down syndrome. This is empowerment in action. When individuals with Down syndrome lead conversations about their own lives, communities grow more informed, more compassionate, and more just. Although the National Down Syndrome Society, NDSS, primarily operates in the United States, US, its influence extends globally. By sharing evidence-based resources, it contributes to a worldwide shift toward acceptance, understanding, and inclusion. Down syndrome is part of the human experience, and when society invests in inclusion, everyone benefits. Behind every program is an individual with dreams. Behind every policy is a future made more accessible. The National Down Syndrome Society, NDSS, continues its mission to champion human rights, strengthen communities, and ensure that every person with Down syndrome belongs. Because progress is strongest when everyone has a place at the table. At 72 Dragons, we celebrate the National Down Syndrome Society's NDSS enduring mission to make healthcare universal, to make survival equitable, and to make health a right, not a privilege. Visit health72.com to discover the innovation and courage driving meaningful change around the world.